Everybody, and welcome to the next event in our 30 years of hope and discovery. My name is Matt Bell. I'm proud to be a board member and the treasurer of the Children's Inn at the NIH, and it's my privilege to welcome all of you to the next in our really fascinating series of 30 years of hope and discovery events, focused on advancing pediatric research and discovery and all the fantastic stories thereof. So I'm a scientist by training. I work by day at AstraZeneca. I've been involved in science all my life, and I've seen firsthand the power of science and medicine to transform lives. And it's really humbling and a privilege to be part of the board at the Children's Inn and to see the fantastic work they do and the lives that they touch. I really, and that's why we're here today, to celebrate the difference that the NIH research can make and how that, when combined with the nurturing care from the Children's Inn, can really make a difference for the more than 14,500 children and young adults with rare and difficult to treat diseases who've called the Inn home since 1990. So let me tell you what you can expect in the next hour. We're very honored to host a very special conversation. And we're going to have a conversation with Dr. Diana Bianchi, director of the Eunice Shriver National Institute of Child and Human Development. We're going to welcome Kristal Meyeroff, an NICHD patient with OI, or osteogenesis imperfecta. You may know that as brittle bone disease. And lastly, we're going to have Beth Mayer, one of my fellow board members, moderate that conversation. And we're going to hear a lot more about the journey that they've each been on at the NIH and with the Children's Inn. Now, that journey has been over 30 years, and in that 30 years, we've had many proud and important supporters, and many of you, of course, on the call today. But I did want to take a moment to say a huge thank you and be thankful for the tremendous support, bipartisan support, we've received from members of Congress over the past 30 years. From the start, the members of Congress and their spouses stepped up to make the Inn a reality. They helped to raise funds to furnish the Inn. They've been key supporters since. And these members of Congress truly have shown that they care about children with rare diseases, and they support NIH Rare Disease, not only supporting the mission of the NIH Children's Inn, but in advocating for vital NIH budget increases to fund the life-saving medical advances that are only possible with public funding. So we thought it would be only fitting to hear from a few of those members now. Let's hear from Congresswoman Cathy McMorris Rodgers of Washington and Senator Patty Murray of Washington.
Hi, everyone. This is Cathy McMorris Rodgers, wishing the Children's Inn at the NIH a happy 30 years. Congratulations. I want to say thanks. Thanks for serving and giving hope to families and children who are receiving treatment at our nation's premier biomedical research hospital. America leads the world in medical discoveries and breakthroughs. The Inn is a shining example of that work and a beacon of hope to the world. To all the children, young adults, and families watching, know that you inspire me every day. That's why we're leading on the Energy and Commerce Committee to support the development and discovery of more cures. I hope your celebration tonight is filled with a lot of joy. Again, happy 30 years of hope and discovery to you all.
I'm so glad to be celebrating 30 years of hope and discovery at the Children's Inn, and I'm so grateful for the work you do for our families. The research the National Institutes of Health conducts and supports has provided countless breakthroughs for families across the country, and the work you do to provide a home away from home for families participating in NIH clinical trials is so critical to making those discoveries possible. It's already devastating for any family to have a child fighting for their life, but it can be especially scary for a child and challenging for their caregivers to move to a new location for treatment as part of a clinical trial. The work you do to provide families lodging, programming, emotional support, and more makes it possible for families to face the unknown together, for them to find comfort in times of hardship, and for researchers to find life-saving discoveries. I'm proud to know that the Children's Inn has had such a strong history of bipartisan support in Congress over the last 30 years, and I'm going to do my part to make sure it has bipartisan support in the future as well. Thank you.
Thanks again. We really do appreciate the support from our members of Congress over the last 30 years and hopefully for the next 30 and beyond. I also want to thank Synergy. You may have heard some of the Synergy texts talking to you as you were waiting. Synergy are helping us put on this event and will hopefully make sure the next hour go very smoothly. So thanks to Synergy and the team there. Okay, so last little bit of housekeeping from me. This is a discussion, it's a conversation. I've introduced 3 of the people in that conversation, but we would like you to be part of it as well. If you have a question, if you'd like to participate, feel free to add that question to the Q&A box. If you have a specific question for a specific person, then mention that in your question, and we'll have moderators here, Beth and others will look at those questions and field them so that some of your questions and ideas can be filtered into the conversation. With that, it's now my pleasure to hand over to my fellow board member, Beth Meyer. Beth is at Deloitte Consulting. She heads up the Government and Public Service group. She's a Chief Strategy Officer. Sorry, I mangled that. Let me try that again. I'm going to introduce Beth, who is the Government and Public Service Chief Strategy Officer and Strategy and Transformation Leader at Deloitte Consulting. That's a very impressive title, Beth. Now, of course, I know Beth as a fellow board member, and I can tell you Beth is absolutely passionate about the mission of the IN and the mission of the NIH. And I couldn't think of a better person to be moderating this discussion. So over to you, Beth.
Hey, thanks, Matt. Great job. And it's a real pleasure to be with this incredible group today. As Matt shared, we work really closely together on the board. It was a complete honor to join the board and then to take over the efforts around diversity, equity, and inclusion that Diana Baker got started for us and had done a tremendous job. So here we are today. I'm really excited to have Dr. Bianchi, who leads up NICHD, and Kristal Meyeroff, who was a patient at NICHD. And with that, I'd love to share with you this incredible inspirational video that Kristal put together.
Hi everyone, my name is Kristal Meyeroff. I'm 33 years old. I'm a registered nurse and I have a genetic brittle bone disease called osteogenesis imperfecta. In short, we call it OI. And what that means is my body does not produce collagen correctly. So it makes all of my bones very brittle, and I've had a lot of fractures, especially as a child. And I was born with this condition. I have been at the NIH in their clinical research study for osteogenesis imperfecta since I was an infant. The NIH, the care there is unlike anywhere you can get in the world. The specialists there are at the top level, trying to find treatments and cures and anything they can to help. While I was staying at the NIH in their inpatient study, we would be there for a couple of days, maybe up to a week at a time, every 3 to 4 months. And so that meant that I would stay in the hospital as like a patient, like in a hospital bed, in a hospital room. And as a child, that was something that was very difficult. But once the Children's Inn at the NIH opened up, we were among the first people who got to stay there. And it was a way for my whole family to be together. To me, the Inn meant normalcy. Going home after a long day of rigorous appointments at the NIH, going home to the Children's Inn was just something to look forward to for both me and my family. My hope for my future personally is to have the best quality of life that I can have and to contribute to research of OI.
Kristal, that was amazing. And to hear your story, and here we are 30 years later to share about the Inn and hope and discovery, and you are living proof of that. It was phenomenal and touching. So thank you for sharing your story. I'd also like to just take a minute and introduce Dr. Bianchi. Dr. Bianchi, we are so happy to have you here today. You lead a large team of over 1,400 individuals and a very large budget of over 1.6 billion. And you had the section on prenatal genomics and fetal therapy at the Center for Precision Health Research at NHGRI. It is absolutely fantastic that you're joining us here today. And I'd love for you to share a little bit about how NICHD is working around advances, particularly treating patients with OI and to help patients like Kristal and others. Welcome.
Thank you so much, Beth and Kristal. I'm so honored to be here and share some of NICHD's important medical discoveries. Our research advances have been possible through the courageous participation of Children's Inn families like the Meyeroffs and the commitment of the Inn staff and supporters to provide a place like home throughout their child's NIH treatments. Kristal Meyeroff and her family are powerful examples of the benefits of clinical research. Kristal and her mother, Carla, represent how two different generations have been treated with, as you heard, the debilitating brittle bone disease known as OI. Both were born in the very same hospital in Pennsylvania, and yet they had vastly different outcomes. Back in 1962, doctors suggested to Kristal's grandparents that they place their preterm baby, Carla, who's Kristal's mom, in an institution for disabled children. Instead, Carla's parents carried their newborn baby home, nestled her gently on a pillow, and raised her long before the United States Americans with Disabilities Act granted equal access for her to attend school and receive other basic human rights. Fast forward 3 decades, shortly before the Inn opened in 1990, by then, Carla was a new mom with Kristal. She heard about a research study being performed at the NIH, and she brought her then 7-month-old baby, Kristal, for evaluation. Kristal, as you heard, participated in clinical research studies at the NIH, traveling to the Inn every few months. Through an NICHD study, she received an intravenous drug known as pamidronate, which ultimately helped her strengthen her bones, increase her bone density, and reduce the frequency of her fractures. Now, I've never treated Kristal, but I've treated children who've had similar osteogenesis imperfecta. And what they told me was the biggest thing for them was that the pamidronate reduced the serious pain that they were living with their entire lives due to the constant fractures. Kristal also benefited from physical rehabilitation regimens at the NIH that included a rolling walker, which is a device that she uses when she needs it. The Meyeroffs and other Inn families have proved the value of clinical research studies. Parents are indeed critical partners. There's several other NICHD medical breakthroughs that have included Children's Inn participants. For example, adrenal gland disorders are among the rare diseases in which Inn families have had a significant impact. The adrenal glands, back here, part of the endocrine system, are small, but they play a powerful part in our body's metabolism and vital functions, the fight or flight response, for example. Carney complex and Cushing syndrome, which are 2 adrenal gland disorders, have effective ongoing treatments as a result of NIH research. NICHD researchers were able to identify the potential genetic cause of Cushing syndrome, in which the body overproduces the stress hormone cortisol. Our knowledge of excessive childhood growth, or gigantism, has also greatly increased through the participation of Children's Inn families. NICHD researchers also discovered the gene responsible for this rare disorder. NICHD also leads research into another rare genetic disorder called Niemann-Pick disease type C, which is a devastating illness that primarily affects children and adolescents and unfortunately causes a decline in neurological and cognitive functions. Numerous Inn families have helped advance treatments and ultimately slowed the progression of this fatal disease. I'm proud of the diligence and the persistence of NICHD researchers to boost discoveries, improve our knowledge, and ultimately find effective treatments for these rare conditions. I'm deeply grateful to the Children's Inn and the families, and am heartened by their stories of their resilience. In addition to finding treatments, I'm grateful that parents and their families show an incredible generosity of spirit by paving the path for future generations of children and medical discoveries. As for Kristal, she didn't give you all the details, but she went on to pursue a nursing degree and worked as a school nurse. Like her mom, she too was determined to have a baby despite the potential medical risks and challenges. As a pediatrician myself, I celebrate the birth of Kristal's healthy son, Clayton, in 2019. I understand that Kristal also celebrates the month after his birth, when she found out definitively from NIH that her son did not inherit the OI bone disorder. Clearly, there are many celebrations and milestones we're proud to honor. The Children's Inn has played a formidable role over the past 30 years in improving the lives of families and helping to advance medical research. Thank you so much for including me and the institute I direct, NICHD, in this anniversary tribute. I wish the Inn many, many more decades of success. Thank you.
Thanks, Dr. Bianchi. That was fantastic to hear about advances. And Kristal, this is really touching to have you part of the celebration of the Inn. As you know, Dr. Bianchi mentioned, you all have really played a critical role in paving the way for many families. And, you know, hearing your story, really, it has been a family affair. So I would love to hear from you, Kristal, as you go off of mute, to share how participating in the research at NICHD has really impacted your health and your life.
I am so thankful for the NIH and being a part of this study. I don't think that I would be doing nearly as well as I'm doing in my adult life without all the intervention that they helped facilitate when I was young. And my bone density is probably one of the biggest things on paper from the study that really changed my life. I went on the experimental drug pamidronate during a clinical trial at the NIH. And at the end of that 1 year that I was on that drug, my bone density went up 21%, which is a lot. So, and off of paper, my symptoms of pain were much better just a few weeks after getting the first infusion of that experimental medication, pamidronate. It was amazing. I woke up one day and about 3 weeks after the first infusion, and I could feel the changes happening in my spine. I didn't have nearly as much pain as I was used to having, and it made middle school so much better, and it traveled with me. It stays in your bones for a really long time. The half-life is 10 years. So as I went into college, I had that bone density drug sitting in my bones, and I was just ready to live my life and start doing great things.
Thank you, Kristal. I mean, what a phenomenal story to share with everybody. You know, Dr. Bianchi, as we heard in Kristal's story, when she started treatment, she was staying in the hospital, and then the Inn opened. I'd love to hear a little bit from you about the relationship that you have with the Inn, and really how that helps with scientific discovery.
Well, the Inn is just such a magical place because, first of all, there are patients who are traveling from great distances and they're coming to the NIH for a long time. And you can imagine what it would be like, never mind the expense, but just the limitations of being in a small hotel room with your entire family, for example. So I think the number one benefit is it is a place like home. It's a place where parents can talk to other parents and get the support of other families. My lab, other labs all volunteer to cook dinner for the families at the inn, and that's just a wonderful group communal effort. And so it really improves the quality of the entire experience, both for the patient himself or herself, but also for the extended family. And because of that, it makes the research that much easier and smoother, where in a sense, from the small child's perspective, it's fun. I mean, they have the mailboxes where the children open the mailbox and get their gift or their message of the day. And it isn't like being an inpatient where, you know, you can't get a good night's sleep. And, you know, it's just not a good quality experience, even though you're there for the medical treatment. So, you know, the inn is really providing this incredible improvement in the quality of life. And there's enrichment as well. I mean, children are going to school, they are doing activities indoor as well as outdoor. So it's, if you can imagine, it has a little bit of a summer camp element to it as well.
Absolutely. I love that you mentioned the little treasures. And I have a 10 and 11-year-old, soon to be 12 this week. And over the holidays, one of the things we love to do is put together, you know, the little treasures for the mailbox. And it's just an incredible opportunity to support the inn and hopefully bring, you know, a small token of joy, but they enjoy every part of it. And, you know, Kristal, I would welcome hearing from you specifically. How has the inn helped you and your family? You shared, I mean, you've been there from the beginning and how you moved from the hospital into the inn and how that could help support you. But I'd like to hear from you. How did it help?
Oh my goodness. Just to explain how awesome the Children's Inn is, I was just at the NIH 2 weeks ago for my annual testing and you know, work over on my bones. And we were staying at the Safra Lodge, and we kept thinking, boy, how much we wish we were at the Children's Inn right now, because it is just such a profound legacy, like for my family, and I'm sure all the families who come through the doors there. And it's a big kid hotel. For people who don't know anything about the Children's Inn, it's a kid hotel on the clinical campus of the NIH, and it's a place where your family can be together under one roof. And what's great is there's so many families there, so you've got friends right there. So you go for your testing during the day at the clinical center and your treatments, and it's like incentive to get those tests done and you know, be good and help everything go smoothly, because you know at the end of the day you're going to go back to the Children's Inn where they have activities waiting for you and your friends are there to play with, and these friends are like no one else, because they're all children who understand what it's like living with a chronic illness or an acute illness that they're studying, but they're children who understand illness, and we all relate and play, and it's just the most phenomenal experience.
Kristal, what would you say to a family that may be at the beginning of their journey, and you know how the your time at NIH as well as at the inn really can help support them? What would be some of the words of encouragement you might share?
Well, I would say that being in a medical research study is a big commitment, but places like the Children's Inn are going to make that burden so much easier. There's going to be a place for your kids to be kids. So it's science and medicine during the day, but when you come back at the end of the day, um just feel comfort knowing that it's just like being at home. There's a kitchen where you can make the food that you're used to. There's game rooms where you could sit down and play a board game. There's a library. You could sit down and read books before bedtime. There's just so many activities there, and it really helps ease the burden of participating in medical research and dealing with the chronic illness. If you can get into a study, it's a good thing all the way around. It's you're helping yourself in the short term, and then you're helping so many people in the long term with the data that you're contributing to their studies.
Thanks, Kristal. One of the things that we love to do at Deloitte is come and do the dinners, like you mentioned, Dr. Bianchi, and it's just been, a joy to be at the inn and to interact with the families and cook, or in my case, make sure I bring food so that everyone has a good time. But it's a really special environment. Dr. Bianchi, I'd love to turn to you to talk a little bit about the research at NICHD. What excites you the most, in terms of the future around the research? What are you seeing that really gets you hopeful in terms of where research is going and the research you all are leading?
Well, I'm going to talk first about the clinical center, but then, of course, as an institute, we've had to deal with COVID extensively. So I'll get to that in a moment. But I think one of the wonderful things about NICHD and our clinical research is that we can go from a very basic discovery, for example, understanding the change in Kristal's DNA and her mother's DNA, and look at that and understand how that change affects how the collagen protein is produced or not produced, and then from that develop therapies. So we deal with a lot of families who have rare diseases, but our special sauce, so to speak, is the ability to take that from a basic science discovery and then apply it to something that directly helps people. And I do want to mention that the treatment that Kristal had on an experimental basis is now standard of care. So she contributed to actually changing the world for future children. So some of my patients who were born maybe 20 years later really benefited from Kristal and the other children who participated in that study. So we have a number of different conditions that are being studied. We also would like to begin to think about treating babies earlier and earlier, even possibly in the womb. And so that's something that's on the horizon right now. In my laboratory, for example, we're doing it in mouse babies, not human babies, but hopefully we'll get there. But I have to be honest and say that for the past year, we've been very, very focused on how we can improve the lives of children, in particular with COVID, because initially it was thought that children didn't get sick from SARS-CoV-2 infections. And now we realize that, yes, there's a small percentage of children who get very sick and indeed can even die from COVID, and importantly, spread the virus to other people. And kids have been out of school for the last year. So one of our major projects that we're working on with the support of the Radix project across NIH is how can we test children and school staff, and this is important because, as you heard, Kristal is a school nurse, but how do we get students and school staff back to school safely and give families the confidence that their children are going to stay healthy and safe and get all the benefits of online learning. So that's really what we've been focused on in the last few months.
Well, it's a great answer. And, it touched on, Tim in the chat had mentioned, how has COVID impacted NICHD's agenda, which I think you covered, and any special plans, which is the second part, any special plans to follow infants born to infected mothers, for example?
That's a great question, Tim. I don't know if it was from Tim or from somebody else, but yes, because about 30% of our research portfolio is in reproductive health research. So we've been deeply concerned about the safety and efficacy of vaccines in pregnant women. And we were very gratified to see reassuring information in the New England Journal of Medicine this past week that pregnant women can safely take the vaccine because there hasn't been an increase in any complications related to that. But he's absolutely right. If a mother gets sick during her pregnancy, with a SARS-CoV-2 infection. What we don't know yet is, we do know that it's unlikely the infection will make its way to the baby directly, but we don't know what the effect will be of inflammation related to the infection in the mother. And it appears that the placenta is a barrier, but the placenta can also take the hit of the infection, and we don't know what effect that will have on the baby. So we are doing, or at least planning to do, long-term follow-up research on the long-term effects of COVID-19 infection, both on the pregnant woman, the child, and on children who have this long hauler or post-acute sequelae of COVID.
Thanks, Dr. Bianchi. You know, as we were hearing about your many roles, tell us a little bit about precision health and research. What is that? And, you know, as we think about sort of the future, why is that a critical part in, you know, sort of the future, so to speak, of research?
That's a great question, Beth. And precision health really refers to creating treatments specifically for you based on your particular DNA, your exposures, your particular state of health. I mean, if I have an ear infection, I'm going to get amoxicillin, which is what everybody gets for an ear infection. But what if that's not the best drug, for example, for the particular microbes that are in my eardrum? Or what if I have an allergic reaction to amoxicillin? So precision health is really saying one size does not fit all. Precision health is specifically for you. And in my research laboratory at NHGRI, we are looking at various safe compounds that could be given to a pregnant woman carrying a fetus with Down syndrome to have her take the medicine, have it get into the baby, and then help the baby's brain develop in a more typical way. And what we found using cells from an amniocentesis, which are actually free-floating cells in the fluid that surrounds the baby, and it doesn't harm the baby to take those cells out, we've found that those cells can react to very different medicines. So we have a series of medicines that we know might be appropriate to treat this condition, and yet each individual has a different reaction. So we hypothesize that we could pick the exact right match for that baby, and that's precision health. So in the future, part of the vision of developing the Center for Precision Health at NIH is to develop these very specifically matched compounds, particularly for people with rare diseases.
It's really fascinating. I mean, it's exciting to see science evolve and change so rapidly. You know, I'd love to go back to COVID because I know many of the participants today probably would love to talk to you a little bit more about that. You had mentioned a program called Radix. Could you share a little bit about what that is and how is that program working with schools and teachers to get kids back into the classroom?
So Radix is actually a huge trans NIH project. NICHD is one of many institutes participating in it. It stands for Rapid Acceleration of Diagnostics. So it's based on the idea that if you can test more efficiently and understand who has it, who doesn't have it, and begin to quarantine people in a very precision health way, you know, not instead of just shutting down an entire school, but telling the kids who do have SARS-CoV-2 infection to stay home, then ultimately you'll control the pandemic. So there are 4 different parts to this Radix program, 2 of which were related to developing very high-tech types of approaches, one of which is resulting in home testing that is going to be available at your local pharmacy soon. We've been more involved in the Radix underserved population, or Radix UP, and then the Radix RAD, which is Radix radical approaches. So in the radical approaches, we're using artificial intelligence and machine learning technology to predict if you have 1,000 children with SARS-CoV-2 infection, who's going to be the one or two that's going to get very sick out of that group. You can't tell when they first test positive, but you'd like to know so you could be able to prevent them getting sick from multi-system inflammatory syndrome of children, or MISC, which you've heard about in the news. So that's the radical approach we're taking. And then in the Radix UP, that's where we are bringing testing to the schools. And this new program, the Return to School Safely program, just has rolled out within the last few weeks. And we have groups all over the country, including tribal schools, including schools that focus on people with intellectual and learning disabilities who have unique challenges with hygiene and wearing masks. And we have schools in inner cities that really address kids who are having great difficulty learning with internet because they don't have access to the internet. So the program has just rolled out. There are essentially 8 different groups that are using testing and using a community-based approach to educate the community about why testing needs to be done.
Absolutely incredible. I am fascinated about how, the radical nature of AI and ML, but also working directly with schools. It's fantastic. And, Kristal, I'd love to hear a little bit about your choice to go into the clinical profession. I know that you are home now with your son, and that sounds amazing, but maybe share a little bit about how you chose to become a registered nurse and your professional journey as well.
I guess as a young child being immersed in that environment, the NIH, the clinical center, it was kind of a magical place for me, seeing just the work that was being done there and the doctors and the nurses. And it really left an impression on me growing up. And I knew I wanted to do something to help mainly pediatrics, because that's where it really impacted my life. So I wanted to give back and help children. And it was a couple of nurses at the NIH when I was getting my experimental drug therapy, who would come in and check on me and just talk, just talk. And they really changed my life. And I knew that was what I wanted to do. So when I went to college, I went into nursing school, and I came with a goal. I said, not only am I going to be a registered nurse, I'm going to be a great registered nurse. And you get what you put in. And I put my whole heart and soul into nursing school, and I came out and was just ready. And I didn't exactly know where my place was going to be in nursing yet. But it just so happened that a substitute school nursing job opened up, like a long-term 6-month position. And I said, well, let me jump in and see how I like this. And it was like a week of doing that job. And I knew this is where I belong in nursing. This is definitely for me, because it was obviously public health and all of the children were something I loved. But what I specifically really enjoyed was helping kids with chronic illnesses reach their full potential in school and have the accommodations that they needed to succeed, because that was something that was so pivotal in my life, was just having the right things. For me, that was having a set of books at home and a set of books at school, or and the NIH, they also helped brainstorm the accommodations that would help me succeed in school. An elevator key. They offer adapted physical education programs in schools now. So they helped coordinate with my PT in school. And I also got PT privately on the side. So I had a lot of PT growing up, and I loved being a school nurse, and I can't wait to go back when my son's just a little bit older. And I love nursing, and the NIH was 100% what guided me into my career.
It's amazing. And, one of the things as I watch your video, but also hear you talk, it's clear that community and the community that the inn helped to foster was such an important part of your journey and for the journey for so many. As a mom, and I'm a mom too, I'd love it if you had any words of wisdom. There's so many people home parenting and struggling. It's hard. Any sort of words of wisdom about how to get through the pandemic during this challenging time?
We take things one day at a time. That's really it. Sometimes you have a bad day and you make the next one a little bit better if you can. And parenting is tough, and parenting with a disability is even tougher. And I had assumed that my son was going to have my bone disease, so I spent my whole pregnancy just preparing myself, and we just expected that he would have it. And when the news came back that he did not have it, my whole world changed to, okay, well, now I have a disability and I have to figure out how I'm going to raise a very healthy, energetic, normal little boy. And so it became, now this is something that NIH is helping me with. When I was just there 2 weeks ago, for like my PT and rehab appointment, and we were talking about the things that are making my life really difficult and what could we do from the parenting aspect to make things easier. So one of the things they suggested was, well, why don't you try moving him to a toddler bed early so you don't have to lift him as much? And I was like, yeah, it's a little early, but let's try it. And we've been doing that for a week, and he likes his toddler bed, and it's a huge win. It's so exciting. And my bones are very grateful that he's 26 pounds. So he was at that point where it was just getting to be way too dangerous for me to lift him. And so they help brainstorm. Sometimes you just got to do that. You just got to brainstorm better ways to do things.
I think that's fantastic. I think that's just, I think all of us should write that down on a Post-it, not only for parenting during the pandemic, but just life. And I'm really happy he likes toddler bed. It sounds really, it was a blessing. Dr. Bianchi, maybe to get a few more thoughts from you. Matt and I, as we shared, are on the board of the Inn. One of the things that's really important is diversity, equity, and inclusion. And I would welcome hearing from you as one of the heads of one of the, significant institutes. How are you thinking about DEI as a leader and as a researcher to really help, make a difference here?
Yeah, well, so first of all, I think one of the amazing things about the NIH and the Inn is there is equity there. You don't get to go to the Inn or the NIH based on how much money your parents make or where you grew up or what the color of your skin is. It's open to all, which is just a fantastic experience. As a former academician, I can tell you that I used to spend a lot of time on the phone with insurers trying to make sure that we could bring a particular patient in to the hospital and that they wouldn't be saddled with an enormous bill. So that is amazing, and everyone should feel incredible about that. With regard to how do we increase the amount of research on health disparities, or how do we increase the diversity and inclusion of both our internal and our external workforces, we at NICHD are working very actively on that through a program called Strive that is unique to our institute and our particular interests, but we are interacting with the larger overall effort at NIH that you probably heard about from Diane Baker, which is the Unite effort, which is trans NIH. So we have representatives who are talking back and forth. This is just getting started, but I can say as the director, I'm deeply committed to increasing the diversity of our workforce. And we've already, I mean, even prior to the past year, made a deep commitment to funding research that is addressing health disparities, in particular related to, for example, maternal mortality, where there are dramatic disparities. But could I just ask a question of Kristal, which doesn't have to do with that, but you mentioned that you were particularly interested in children with chronic pain and chronic illness. And one of the things that I didn't mention is that we are taking a particular interest in NICHD as in the transition to adolescence, that children with chronic disease who have been very well treated by their team sometimes have difficulty being treated as adults. And I wondered how that transition went for you. It's an area that we're doing more research on.
I experienced that 100%. Finding local care that I could trust as an adult. It seems like there are so much more care opportunities for pediatrics. Like in my state of Pennsylvania, we have CHOP and we have the Janet Weiss Children's Hospital. But once you age out of those programs, what's left for you? Well, especially in rural areas, there's not much. And I have a lot of friends with OI who also experienced the same thing, where when we aged into adulthood, we were kind of left scrambling, like, well, what do we do now that we've aged out of these programs? And one thing that I'm so excited that the NIH has done was, now my study with osteogenesis imperfecta that I was in was from infancy to adulthood. So once we aged out, we kind of sat for a few years, but then they contacted us children who were in this study and said, hey, why don't you guys come back as adults? Because we have just made some criteria for an adult study and we want to follow you, through many, many years and see what happens as you age. And I think that is such a wonderful thing. Because it's more research aimed at improving the quality of our lives, like through the lifespan now. So I think that is probably one of the best things that the NIH is doing right now, is following these chronic illnesses up through adulthood and beyond. So we could just learn more.
Fantastic. Dr. Bianchi, I would love to go back to the radical part of Radical RX program. How is AI and ML being utilized to help discover and advance science?
So I can speak from the perspective of NICHD. There actually have been quite a number of advances in different areas using AI, for example, to very rapidly understand the cause of the illness of newborns who are in an intensive care unit, not due to prematurity, but who are in the intensive care unit because they are very sick from an unknown cause. They're formed in a typical way, but their metabolism is atypical. And so what's being done now with NICHD supported research is to very rapidly sequence their DNA and then use artificial intelligence and machine learning to understand in a very quick manner which of the changes in the DNA code are most likely to be the cause of the child's problem. And we have one researcher who has taken that approach and been able to reduce the time from DNA sequencing to diagnosis to only 20 hours. So it's really quite important because that really does dictate the way the baby is cared for, and it has saved hundreds of thousands of dollars. But with regard to the Radix RAD program, we have these different groups that are they're all taking a slightly different approach, but they're using different biospecimens, whether it's blood or saliva, and they're looking for particular proteins or markers of the immune system They're using the electronic health record and then, additional laboratory values and tracking those children. So for example, we have one project we're supporting at the Children's Hospital of Philadelphia, which Kristal mentioned, where every child who's coming into the emergency room with a fever is getting studied if they agree to be studied. And then they will use the information on children who ultimately get this MISC, this more severe version, and then use that as a learning tool to then go back to children who are not yet diagnosed with MISC to see what are the best predictive markers. So it's something that doesn't necessarily help children who are presenting today, but the lessons learned will be very useful. Let's hope the pandemic doesn't continue, but if it does, the data will help, and the approach will help us with other viral illnesses in the future as well.
Excellent. Well, it's hard to believe that we're here at our last question, and I'd love to ask both of you one final question. So Kristal, we're here today because we're celebrating 30 years at the Inn, Hope and Discovery. If you were to have a wish for the Inn and the families for the next 30 years, what would that wish be for the community?
I would say that funding is continued so that they could keep the doors open and keep the kids coming. That is my wish for the Children's Inn, because the medical research they do there is truly changing lives. It has changed my own life, and it is making medical decision making. It's making it so much easier for families around the world. So that is my wish for the Inn.
I think that's a fantastic wish. Dr. Bianchi, I know we've talked a lot about COVID and, both the trials and tribulations, but also the pace of scientific discovery, the pace of innovation. Anything that you hope for sort of in the future around the new normal, around how these changes ultimately can help support clinical research and research in the future?
Well, certainly COVID has taught us a lot of new things. I would say, first of all, it's really broadened the people with whom we can collaborate, the people who can listen to our workshops and our educational events. We can learn from people, for example, who are in Australia. I think Matt might have an Australian accent, I'm not sure, but it would have been prohibitive to bring many Australians into our workshops, for example, but now we can gather the expertise from people who are as far away as Perth, which I think is the farthest you can get from the East Coast. We've also learned how productive we can be working from home. Of course, our scientists need to be at the bench, and they have been working at the bench. Probably not as many people as would like to be working at the bench, but our focus has been on keeping people safe. But as people get vaccinated, we will bring more and more people back to campus. And yet we understand there's flexibility in how people work and when people work. And I think that, it's been just a tragic experience, but so many lessons have been learned. And I am so proud to work at an organization that really contributed to the fundamental discoveries underlying vaccination. When I got my Moderna vaccine, I really thought about what was going on the NIH campus that led to those discoveries. So it's a very interesting time, and we're grateful for everyone's support so that we can do more and reach more families.
Fantastic. Well, with that, I would like to just take a moment and thank Kristal, you and your family for sharing your journey, being a part of the Inn from the beginning as we celebrate 30 years today of hope and discovery. And it was absolutely just a privilege to spend time with you and hear your story. So I want to say thank you. And Dr. Bianchi, on behalf of all of us, it is remarkable to hear the incredible impact that you and your research is having on families like Kristal and others, and also a huge debt of gratitude to you and all of your colleagues at NIH during this remarkably challenging time, but also hopefully a time of hope and where we can really come together again. And with that, I'd love to turn it over to my friend Matt and board member colleague for closing us out. It was a real pleasure today. Thank you.
Awesome. Thanks so much, Beth, and thanks to everybody on the call for listening and for your questions. It's been a real celebration. That's what this event's all about, is celebrating 30 years of hope and discovery. I don't know about you, but I felt it was really a celebration of all the elements that are important, right? The underlying scientific research, the clinical studies, how important they are, the patient experience, what it means. And, Kristal, I really appreciated you sharing not only the clinical aspects, but some of the things we don't even think about. The comment you made about your son gets to a certain weight, and then that becomes important, right? So just really illustrating the full breadth of a rare disease and what it means, I thought was really important and really nice to hear about. So I want to thank you, Kristal, for sharing your story. I also want to thank you for the request you made. I can tell you, as the treasurer of the Children's In Board, we think about funding every day, because it's really important that we keep a strong financial foundation so that we can continue to be a place like home for you and others for as long as possible, basically. So I absolutely echo that. Thanks, Dr. Bianchi, for all the fantastic work you do. Thanks for sharing again the perspectives that you have. And as the father of 2 boys at school, I also was really happy to hear about the work about COVID and trying to get kids back to school. I mean, it's so important, right, for us to return to some form of normalcy. So again, just illustrating the breadth of the work and the research that goes on at NIH. And thanks to you, Beth, for your fantastic moderation, a really great questioning. I think you got to many aspects of what it means to be at the Children's Inn, and a really fantastic conversation. And thanks to Deloitte as well for sponsoring this event. So with that, I just have one last thing to say, which is to thank our sponsors and to ask all of you to join us to our next and last session. On May the 5th, so you have a little bit of time to plan, we're going to be hearing from Dr. Ned Sharpless. He's the director of the National Cancer Institute, and he'll be talking, having another conversation with you, continuing to celebrate 30 years. So in the meantime, we're at time. Thank all of you for listening. Thank you for your support of the Children's Inn. Stay well, and we'll see you on the 5th. Thanks so much.